The pulmonary artery catheter is a flow-directed, balloon-tipped catheter that is used as a diagnostic tool. It is also known as a SWAN-Ganz or right heart catheter. It is used to monitor the heart's function and blood flow, along with pressures in and around the heart. These real-time hemodynamic measures, together with clinical observations, are a good indication of how the heart is functioning. As the PA catheter floats through the cardiac chambers, the waveforms change to reflect the intracardiac pressures. Continuous cardiac output monitoring with a SWAN-Ganz is one of the most commonly used PA catheters in the ICU. PA catheters are the gold standard with regard to advanced hemodynamic monitoring, which is used to standardize all non-invasive monitoring systems. The general components of the continuous cardiac output monitoring catheter are shown here. Take a moment to review. When done, click anywhere to continue. The SWAN-Ganz should be considered for many different reasons. Listed here are just a few instances. The items highlighted offer crucial information on the patient's overall status and give insight on how to further treat when an Impella device is in place. Take a moment to review. When done, click anywhere to continue. There is no guesswork to the benefits of continuous real-time hemodynamic data. These include pressure measurements as well as SVO2 and continuous cardiac output monitoring, the ability to be inserted rapidly at the bedside without the need for fluoroscopy, differentiation of various types of shock to allow the physician to understand the underlying condition, estimation of the left heart filling pressures by use of the wedge, hemodynamic data to help guide therapies to the physician and medical staff, a link to improve survival in cardiogenic shock when a PA catheter is used. There are risks placing a SWAN in any patient. Here are a few of the most common risks included in these 4 categories: central access, PA catheter insertion and manipulation, indwelling PA catheter in CV system, and death. Take a moment to review the potential complication, incidence percentage, and how to avoid. When done, click anywhere to continue. The term Pulmonary Artery Pulsatility Index, or PAPI, is fairly new. PAPI is a hemodynamic measure specific to right ventricular dysfunction and failure. Calculating the PAPI score is easy, although it does require a PA catheter to get the numbers required for the calculation. Monitoring the PAPI score is very helpful in identifying patients that are at risk for developing RV failure and offers the ability to intervene quickly, which can improve patient outcomes. As the pulmonary artery catheter advances through the heart, waveforms display the pressures of the heart leading to the lungs. Let's take a look at these waveforms and what it means. As the PA catheter advances into the right atrium from the superior or inferior vena cava, the right atrial pressure, or CVP, is measured. The waveform demonstrates when the tricuspid valve opens and closes, and also when the atrium contracts to empty its contents into the right ventricle, which is known as the atrial kick. Respiratory variation is also seen when measuring the CVP. When measuring central venous pressure, it is important to remember that a central venous pressure line or lumen that is the most distal to the catheter tip, which is the closest to the heart, will give you the most accurate measurement. Internal jugular veins are a site chosen frequently. This access site has a high rate of successful insertions with a low rate of complications such as pneumothorax. Subclavian veins are also chosen frequently. Recognizable anatomical landmarks allow for easier insertion. This site is positioned beneath the clavicle, which does increase the risk of pneumothorax during insertion. Femoral veins provide rapid central access during an emergency. Once the catheter tip crosses the tricuspid valve, the right ventricular pressure will be displayed. The waveform is very tall and peaked, similar to a left ventricular waveform. However, the systolic pressure is much lower on the right side, whereas the diastolic pressure is very low, as the chamber should be emptying most of its contents during contraction. The right ventricular pressure is normally 15 to 30 over 0 to 8, and normal RV and diastolic pressure is around 5 millimeters of mercury. The pulmonary artery pressure is the pressure supplying blood flow to the lungs. The waveform resembles an aortic waveform, however with lower pressure. The pulmonary capillary wedge pressure, or wedge, is an indirect measurement of both the left atrial pressure and left ventricular preload in the absence of mitral valve disease. The wedge pressure should equal LVEDP in a patient without mitral stenosis or regurgitation. Let's discuss the data that both supports and opposes the use of PA catheters. So what does the data about PA catheter use on mortality show us? The PA catheter studies demonstrating negative or no impact on outcomes had few to no cardiogenic shock patients. Here is the data that demonstrates increased survival in cardiogenic shock when a PA catheter is used.